All right, I think we've got some callers on the line, so let's go. You're on the air?
Good evening.
Good evening.
Great topic. I have a question, and it has to do with mountaineering.
So, with who? Sorry?
Mountaineering.
Mountaineering.
In the 6 to maybe...
Caller, can you turn your radio off, please?
Oh, sure.
Just getting a little feedback.
Is that better?
Let's go. Let's try that, yeah.
Okay. Mountaineering in the 6,000 to 8,000 foot range, maybe even up to 11,000 feet. Normally we would use a technique of a big abdominal exhale when we're feeling the effects of the altitude. But what you're saying is you should breathe into a bag instead and breathe in your own CO2?
Yeah, on one of the Everest expeditions, I think it was on Everest, they were treating people by putting them in a bag, big plastic bag with oxygen, and that's a fairly standard way to treat them, and it works. But they found that it was the carbon dioxide that they were breathing out that was accumulating in the bag, which was the really therapeutic agent.
Uh-huh. So that would be a good technique to test, is to have, a paper sack and to exhale into it, or a plastic bag and to exhale into it, and take maybe 30 seconds of deep breaths into it.
I think so. People with high blood pressure, I've seen several of them in a day or two bring their blood pressure down 30 points just by bag breathing repeatedly.
Okay, well, thank you. We'll try that this winter.
And also, Dr. Peat, you've mentioned before that you can breathe. If you tightly seal the bag around your mouth, you can breathe in and out of that bag for a couple minutes if it's a big bag.
Yeah.
Before you start to feel uncomfortable. And just that small amount of bag breathing can increase your carbon dioxide, which means a lot of your cells work better and you're getting more oxygen into the cell.
Yeah, how the adaptation works is that each time you increase the CO2 to an uncomfortable level, it's suppressing the lactate a little bit and lowering the adrenaline and various other factors, free fatty acids and many things that cause you to hyperventilate. And so you're basically curing your tendency to breathe too much by adapting to repeated exposures to extra CO2.